Hey gang, Dr. Jeff Garofalo from Legacy Chiropractic and Disc Centers of America, Northeast Indiana, from Shipshewana. I'm excited to talk to you today about something called a slip disc, a herniated disc, a bulging disc, and stenosis. But before I go there, I'm super excited to let you know that all the hard work and effort paid off. So here, as you can see, is my national certification paperwork that came in. I'm now officially nationally certified. Department of Continuing Education certifies that Dr. Jeffrey Garofalo has successfully taken a complete 12-hour course to study of decompression certificate program given under the seal of Park University, Dallas, Texas, 17th of November, 2019. So all the hard work and effort is paid off. There's a 3-part decompression seminar that we've completed. So I'm now nationally certified in non-surgical spinal decompression to go along with my certifications in MRI analysis that I got way back in 2013 and spinal biomechanical engineering between 2013 and 2015. So I'm proud and excited to be a spine specialist, not only for humans, but I'll also tell you, and I'll show you that diploma at some point as well. In August, I completed a 2-year, 240-hour animal chiropractic certification, learning all about the spine of the animal and how to help animals, not only humans. So we are spine in our office in Shipshewana here. And so today I wanted to talk about some interesting statistics. I want to talk about something called the slip disc, the bulging disc, the herniated disc, and something called stenosis. The slip disc. Actually, there is no such thing as a slip disc. The disc itself cannot slip, but the bones can slip on the disc, putting pressure on the disc that doesn't belong. And that disc is like a water balloon. And when you squeeze the water balloon where it doesn't belong, at some point it bulges out, and that's a bulge. After a while, when the bulge starts to weaken the disc, you can have a small little segment blip out. Less than 25% of the disc will blip out like a little balloon, and that's called a herniation in any direction. And then finally, when there's enough fluid that leaks out of that disc, the disc decays and shrinks, and you have a decaying disc. And ultimately, all of that can close down the canals where the spinal cord and the nerves come out of, causing a stenosis or a pinching of the nerves, which can lead to neck pain, pain down the arms into the shoulder, down to the hands, pain in the low back, all the way down the legs. So I'm just going to do a brief video. I wanted to share with you that we're nationally certified in Shipshewana. Again, the practice is Legacy Chiropractic and Disc Centers of America. I'm officially part of Disc Centers of America. It's a national brand. We specialize in helping non-surgical disc problems, non-surgical spinal decompression. We'll talk about it in just a moment. So let's look at this. I want to share this with you. If you look at this, going up the scale here, it says age of patient, and going across, it says percent of damage to the disc. And what I thought was quite interesting is between your 40s and your 80s, the percent of people who have disc degeneration in your 40s is close to 75%. And once you hit 80, it's almost 100%. For a disc bulge, it's somewhere just north of 50% if you're in your 40s, all the way up to over 80, to about 80% in your 80s. And then as far as a herniation is concerned, it's somewhere about 35 to 40% in your 40s, all the way up to almost 50% in your 80s. So in your 40s, if you have not taken care of your spine will have some sort of disc problem, whether it's a bulge, a herniation, or we call it degenerative disc. Somewhere between 40 and 80, if you didn't take care of your spine, it's going to happen that way. And so I want to talk a little bit about non-surgical spinal decompression. The next visit, we'll kind of go more into it. But non-surgical spinal decompression is not traction. There are a lot of chiropractors and doctors out there who are prescribing non-surgical spinal decompression, but really their tables are traction tables. They're not true decompression tables. Traction tables in the research pull the entire spine open and only get a 50% success rate because you're wasting energy on levels that don't need it. If the disc isn't injured, why are you wasting energy on it? So traction tables, there are traction tables out there. And again, you'll want to ask your doctor, is it a traction table or a decompression table, because they are different. A decompression table will have a couple things. Number one main thing it has is it's got a tower, at least a 7-foot tower by the foot, because with spinal decompression, You can pull open the one segment of the spine that has the disc problem and pull on that segment only. And that, in the research, has shown by Dr. Norman Shealy, by the Mayo Clinic, by Harvard University, by Stanford, has shown to get up to a 90% success rate on healing that disc, whether it's herniated, bulged, or degenerative. Whereas traction tables, where people are marketing decompression, but really they're traction tables, you're getting a 50% success rate. And that's maybe why, if you've done decompression, didn't get great results, that's why. But in our office, we use a true spinal decompression table called an Spinal by North American Medical, where all the research was done on a true decompression table. And in our office, we can get up to a 90% success rate through the research because we can pull open one segment and create a negative pressure. See, what our tables allow us to do is to relax the muscles around the spine, trick them, relax them. As they're relaxed, that's what allows the spine to gap open and open up and create a negative pressure and pull that disc material back in, number one. And number two, our table specifically has what's called oscillation, which is patented to the Accuspina. And that's like a plunger effect, where it brings nutrients into the disc and pumps toxicity out, allowing that disc to heal. So again, there is a difference between decompression and traction tables. You'll want to know that difference. But again, somewhere between the age of 40 and 80, if you have not taken care of your spine, you will have some sort of a disc issue, whether degeneration, herniation, or a decaying disc. Now, not every patient requires surgery. Surgery has somewhere between a 74 and 80% failure rate. With non-surgical spinal decompression, we can get up to a 90% success rate, with the research showing that 4 years later, up to a 74% success rate still on people going back to work and living a great life. So again, your options: surgery can be challenging. I'd think twice, get a second opinion. Okay, we read our own MRIs. We're there for your second opinion. Second thing is, you can do pain pills. The only problem is what I discovered at that national certification. And again, I'll share this with you again. It just came in the mail today. We took the rigorous course a couple weeks ago here, and just came in today from Park University. I did not know this, but within a week of taking opioids, pain pills, you were officially addicted. So you could do pain pills, but you got to run the risk of being addicted, or a technique called non-surgical spinal decompression. So in our office, we are spinal specialists. Okay, we specialize. We do thorough examination, orthopedic testing, neurological testing. We tap reflexes. We make sure we know which nerve root is potentially damaged. And then we use imaging because we want to know. To see is to know, to not see is to guess. So we take x-rays on all of our patients. We take x-rays 5 years old and older. We want to know what's going on in that spine. Is there something there that's going to prevent us from taking care of you? And then if we're suspect you have a disc problem, we absolutely require an MRI, magnetic resonance imaging, to take a real good look at the discs. At what level? Is it left? Is it right? Is it a central herniation? Is there an annular tear? What's going on with the disc? And a lot of doctors do not read their own MRIs. I'm certified to do that. I'm actually about to complete a mini fellowship that I've done. And so I read my own MRIs. You've got to see the MRI to know exactly what's going on. You've got to compare that with the signs and symptoms of the patient with the exam findings, so that you can get specifically on which level needs a decompression pull. And then we've got research data to show how we can help get you recovered. This is Dr. Jeff saying have a great day. We'll see you soon.